Your doctor will work with you to develop a treatment plan for your ulcerative colitis. This plan will likely change over time, depending on whether your disease worsens or you go into remission for an extended period. Treatment options include medication, dietary changes, and surgery if necessary. 1. The goals of treatment for ulcerative colitis are treating acute attacks, inducing remission, prolonging disease remissions. 2. Initially, your doctor will prescribe medication to treat your ulcerative colitis. If drug therapy fails or an emergency develops, your doctor is likely to recommend surgery to remove a portion of your colon or all of it. In most cases, surgery for ulcerative colitis removes the entire colon. This usually means removing the rectum as well. 2. Drug therapy for ulcerative colitis. Most drugs prescribed to treat ulcerative colitis work by suppressing the inflammation in your colon. This allows the lining of your colon to heal and reduces the severity of symptoms such as diarrhea and abdominal pain. 1. Typically, your doctor will prescribe one or more of the following drugs. Aminosalicylates. These drugs are used to treat disease flares, and can help prevent future ones when taken as maintenance therapy. Because they work directly in the digestive system, aminosalicylates have a relatively low risk of negatively affecting other areas of the body. Corticosteroids, also known simply as steroids, these drugs are used to treat active disease. Because of their higher risk of side effects, steroids are usually reserved for moderate to severe disease, and shouldn't be taken for long periods of time. Immune system suppressors. These drugs work directly on the immune system to reduce inflammation. They're used to treat disease flares, as well as prevent future ones when taken for maintenance therapy. For many people with ulcerative colitis, a combination of immune system suppressors works better than one drug by itself. 3. Other types of drugs your doctor may prescribe include antibiotics. If you're running a fever, your doctor may prescribe these drugs to help prevent or treat an infection in your colon. Antidiarrheal medication. This type of drug should generally be used only to treat severe diarrhea, since it raises the risk of developing toxic colitis, a dangerous complication. Pain relievers. Your doctor may recommend Tylenol, acetaminophen, for mild pain. Avoid Advil or Motrin, ibuprofen, Aleve, naproxen, and Voltaren, diclofenac, which can worsen ulcerative colitis symptoms. Iron supplements. Taking supplemental iron may be necessary if you have chronic intestinal bleeding. 3. Surgery for ulcerative colitis. Ulcerative colitis can often be eliminated through surgery, but this course of treatment shouldn't be taken unless it's medically necessary. About 1/4 to 1/3 of people with ulcerative colitis eventually become candidates for surgery, according to the Crohn's disease that doesn't respond to multiple types of drug therapy. Severe complications, like toxic colitis, a ruptured colon, or extensive bleeding, abnormal cells, or dysplasia in the colon, which puts you at high risk for colon cancer. 2. While it's possible you'll only have a portion of your colon removed, surgery for ulcerative colitis usually involves removing the entire colon and rectum. 4. When your rectum is removed, the surgeon must create an alternative way of moving waste from your body. For example, a proctocolectomy, removal of your entire colon and rectum, may require an ileostomy. In this procedure, the surgeon creates a small opening in the abdominal wall and attaches the tip of the lower small intestine, the ileum, to the opening. Waste exits the body through this opening and must be collected in a pouch or bag. 1. In an alternative approach, called ileoanal anastomosis, your surgeon may create an internal pouch out of the ileum and connect it to the anus. This allows you to pass stool fairly normally. 1. Removing just a portion of your colon may be considered if you have limited disease. In most cases, though, this option doesn't go far enough to address the problems that require surgery. 4. Related, how to care for a loved one after colitis surgery. Home remedies for ulcerative colitis. A number of lifestyle measures can help control ulcerative colitis symptoms and reduce the stress of living with this chronic condition. Check with your doctor before trying any of the following approaches to managing your disease. Eating small, frequent meals compared with eating 3 large meals each day. This lowers the likelihood of abdominal discomfort after eating. Probiotics. These supplements help fortify the good bacteria that's normally present in your intestines. In many cases, they have been shown to reduce symptoms of ulcerative colitis. Foods that naturally contain probiotics include yogurt with live cultures and